Hello everyone, I am Parvati and today I am going to talk about empowering change, collaborating to improve the social determinants of health of indigenous peoples. According to WHO, social determinants of health are the conditions into which a person is born, has to live, work and age, and these are supposed to have a substantial effect on the health outcomes of that individual. Income drawn, education gained, employment status are usually what are the ones thought to be social determinants of health. Actually, it's just the proximal determinants, which are further decided and developed by intermediate determinants like governments and other players in the form of Justice Department, education, health, social service, etc. And finally, the driving force behind both these determinants, the indigenous people specific set of determinants that were given recognition at a symposium on the social determinants of indigenous health in 2007, the invisible yet most critical distal determinants of health. As students, we have access to data on social determinants of health of indigenous peoples throughout our courses. Their poor education leading to unemployment or low income answers as to why they are mostly in the state of poverty, which further increases chances of having poor housing facility, increased food insecurity, increased substance abuse, stressful family lives even for their children, leading to depression and other mental issues. Since I am in the healthcare system, these graphs catches my eye. This shows how during the pandemic indigenous peoples, be it First Nations, Métis, or Inuit, all show poor health. And if we look closely, this is in spite of them having unreliable data. When it comes to seeking health care, it's still problematic. Like we can see how even under direct federal government schemes, indigenous peoples experience increased unmet needs for their health care when compared to their non-indigenous counterparts. There are many reasons said for this disparity, but the most important are the systemic barriers, geographic barriers, economic factors, and barriers to indigenous people's specific needs. That's when we need to understand the concept of health for indigenous peoples. It captures physical, mental, emotional, and spiritual aspects of an individual, along with his or her responsibilities and respect for the self, family, community, and their land. Introduced social, economic, and political changes in Turtle Island that deeply affected the very concept of health for the indigenous peoples. Children in their early developmental stages got kidnapped from families in the name of education and were brutally and violently abused, leaving them traumatized for life. This residential school system is still followed in the name of foster care. Racism has always been the building block to colonialism. Its detrimental effects are seen to this day even in healthcare systems in the form of systemic racism. Indian hospitals, like Buchenwald camps, were built to capture, torture, and experiment on indigenous peoples, both adults and children alike, all in the name of medical and health care. Preventing indigenous peoples from using their traditional languages, destroying their right to conduct healing ceremonies under the Indian Act and its amendments were all ways of breaking down indigenous peoples spiritually. But according to scholars, relocating indigenous peoples to northern icy regions or confining them to reserves that lack even basic necessities had the most traumatizing effect on indigenous peoples who value their connection with their land as their way of living. Thus, to conclude, I want my presentation to provide an awareness as to how deeply and negatively distilled social determinants of health affect the livelihood of indigenous peoples. We need to realize that despite these historical injustices, violence, and discriminatory powers acting against them, indigenous peoples have demonstrated great strength and resilience. Empowering change requires collaboration, not just from governments and healthcare organizations, but from all of us as well. I recognize that I do not have the right to define the healthcare related needs of Indigenous peoples with my knowledge in Western medicine, and that it's crucial I listen to and engage with them, since it's their voices, knowledge, and lived experiences that are key to improving Indigenous people's health and well being. Real change to healthcare barriers will happen when Indigenous peoples are actively involved in decisions that affect them. Thank you.